Do you think, here's the better question, do these people actually think that a 19-year-old kid is going to develop heart disease in the 9 months he's eating this much food?
Let's talk about that.
Let's.
How long does it take to develop heart disease? I bet, do you know? Probably not. Heart disease starts in utero, first of all. We start depositing plaques in our arteries when we're in the womb. And then it happens little by little by little by little by little. And men start to have heart attacks in their 50s, women in their 60s, if they're predisposed to having heart attack.
If they are, yes.
But all of us are depositing plaques from the moment that we are conceived.
Right. And plaques are what?
Fatty deposits on the arteries.
On the inside of the lumen of the artery.
Yeah.
Why are they deposited?
Stumped him.
Fuck, you did stump me. I never thought about that. Why are they deposited?
Why are they deposited?
Well,
let's talk about that because
hold on.
if you ask Linus Pauling and Matthias Rath, they will tell you that, and I don't know how much of this is still in vogue right now, but Pauling's idea was that the vitamin C thing notwithstanding, his idea was that the plaques, and this is not just Pauling, this is lots and lots of people have understood that those plaques are in response to oxidative damage within the artery, and the plaque is a patch for damage to the artery's lumen, and it is a functional response to oxidative damage. Now, if you take that one step further, Pauling said that oxidative damage was mitigated by vitamin C supplementation, and he advocated high doses. That's less interesting to me than the fact that high serum cholesterol, or the presence of cholesterol in your blood, is absolutely normal. It is a function of a normally functioning cardiovascular system. It is a problem only at extremely high levels of cholesterol, and even elevated cholesterol levels are not indicative of any process that might lead to heart disease. And I am aware of the total mortality curves that correlate to serum cholesterol. The sweet spot, the lowest total mortality, is at about 180, and the tails, very low cholesterol and extremely high cholesterol, are where the mortality concentrates.
Yeah.
Right. So, in other words, low serum cholesterol is inability to repair the damage. Very, very, very high hypercholesterolemia is indicative of an over response to the oxidative damage that is harmful in and of itself. But cholesterol itself is and plaquing is a perfectly normal response to having blood run through your arteries.
Yeah. So I guess I just didn't understand your question for some reason, but it all kind of came back to me.
Right.
So what you're talking about, where that comes from is they've done papers on this over the last 40 years probably. And what they've observed is when a human eats a high-fat meal, there's an inflammatory response, and you get oxidative damage, which is what you're talking about. Then your endothelial walls, which is your first layer of your artery, become more permeable, which for you that means that things can pass through them easier. And then you get these fatty acids that are circulating through the blood that penetrate through and do essentially what you just said, patch up the rupture, because you got to think about what an artery is. An artery is a high-pressure system.
Yes.
So you got lots of water going, or not water, scratch that, blood pumping through them. Yeah, fluid. I don't know what.
Right.
And because it's a high-pressure system, they're subject to a lot of stress.
Sure.
So then,
and that's why arteries are muscular.
Exactly. Yeah. So the closer you get to the heart, the more pliable they are. The further you get away from the heart, the more muscular they are. So when you're close to the heart, this is why they're always talking about coronary artery disease, right? So they're ballooning out and they're coming back. They're stretching and recoiling. And that's because they're close to the heart. So the heart has to pump out blood, and the stiffer that they are in that region of the body, the harder the heart has to work. And the harder the heart has to work, the more negatively it adapts, because what is the heart? It's a muscle that beats 24 hours a day, 365 days a year. What happens when you train harder? You get bigger muscles. So if the heart has to work harder unnecessarily, and this is called pathological hypertrophy,
Right.
which means that it has to grow thicker in response to the pathology that's caused
in response to normal baseline loads.
Yeah.
Not exercise loads, but normal baseline loads.
Yeah, so if you're eating like a pile of shit for, 30, 40 years, making it have to work harder, it gets thicker. And if it gets thicker, it can't pump out as much, right? So you're not getting as much oxygen circulating through your body, and that could lead to heart disease. This takes decades to happen.
Right.
The 3 months of drinking a gallon of milk a day isn't going to cause pathological hypertrophy of the heart, which is a negative enlargement.
Or pathological hypertrophy of anything else.
Exactly.
Okay.
This is decades.
We just spent 5 minutes explaining why you shouldn't have typed that.
Yeah.
Okay? But you typed it anyway because you're a stupid motherfucker. Okay.